Good afternoon, everyone. And thank you very much, Patricia. Great to be here. Some fantastic presentations, so I hope to keep the very high standard up. What I want to talk to you about is our journey we've had in the last 3 years since we have launched our tobacco heating product Glow in Japan, and the scientific assessment that we've made of that there product. So I'll start off with just outline our approach to assessing Glow. I'll then run you through 3 years data in about 40 seconds. And then I just want to focus a little bit about at the end about how we're going to try and assess population health impact. Okay, so there's epidemiology out in the world today that shows the risks of smoking cigarettes. We heard this morning on several occasions about the excellent epidemiology that exists in Sweden in support of snus being a reduced risk product. A lot of really positive noises in the UK. Again, we heard a lot about in terms of support for e-cigarettes and their risk reduction potential, so I'll not go too much into that there. But some of these next generation products like tobacco heating products and e-cigarettes haven't been around that long, so we took the approach of having a really multidisciplinary assessment framework to our next generation products. We categorize it into 3 main buckets. We look at the emissions, so that's basically what comes out of the product and its effect on toxicity tests. We look at exposure, typically short-term human studies, sometimes in clinics, looking at how consumers use the product and what chemicals are left in their body after switching from smoking after a short period of time. And then we also look at risk, and we have to look at risk at both an individual and a population level, so I'll come to that in a second. Okay, so just the starting point, and this is the sort of the reason to believe around these next generation products. So if you look at a typical cigarette, there's tobacco in a cigarette. The main aerosol formation arises through combustion and pyrolysis. A lot of publications about the number of constituents in cigarette smoke. Lighting and combusting tobacco forms probably the largest chemical reaction in the world, about greater than 6,500 components in cigarette smoke. And the toxicants, of which is about 150, are typically formed, one, through the transfer of these toxicants from the blend into the smoke, or else through some pyrosynthetic processes during pyrolysis and combustion. And I just have quite a simple 3D GC-GC scan. Tanvir showed you something similar earlier on of cigarette smoke, and you can see the complexity of the number of peaks, which represents the large number of compounds in the smoke. Now, when we look at tobacco heating products, and selfishly, I've pulled out our product, Glow. It contains tobacco. It mainly forms an aerosol through distillation and elution of chemicals from the tobacco. It's got a maximum heating temperature around about 240 degrees. So what we see when we look at our untargeted scans going right down to the nanogram level, there's around about 700 to 1,000 components that we can identify in the aerosol of Glow. And so how could toxicants arrive in the aerosols of tobacco heating products? Well, if they're not properly managed, they're not properly made, you could get transfer of toxins from the leaf. You can get thermal degradation of the humectants, so glycerol, propylene glycol, if they're not well designed. And you have to also be careful about the actual materials you select in the product, especially the device, looking at extractables and leachables that come from plastics, metals, etc. during heating. And as you can see from a very similar GC-GC scan, you can see that the much fewer compounds in the aerosol of Glow, represented by the lesser number of peaks in the scan. So, first step, we wanted to see, well, does Glow actually combust tobacco? So we have a 5-step assessment approach to this here. We look at thermogravimetric analysis. So can we actually do a mass balance of what is eluted from the product into the aerosol pre and post use? And we see that about 30% of weight comes off the product, and that there can be explained by about 15% glycerol that's applied to the blend and about 14% water, and the rest is nicotine, tobacco volatiles. We look at the temperature profile of the product during use, and it's a maximum about 240 degrees, which is substantially lower than the combustion temperatures in cigarettes, which are around about 950 degrees centigrade and higher. We've been doing research on combustion in BAT since the 1950s. So we look at oxides of carbon and nitrogen to determine combustion mechanisms. And what we see in GLOW is that there's, in some cases, these oxides are non-measurable, and in other cases, they're at absolutely trace level, maybe 2% of that from cigarette smoke. We look at the toxicant generation. I'll come into that in the next slide in a second, but we see substantial reduction in the levels of toxicants. And then we also look at the integrity of the product pre and post use. So you see when you light and combust tobacco, it burns down forms of smoke, leaving the filter and ash, whereas the product is intact, the neostick is intact pre and post use. So the first step is then to look at the toxicant levels within GLOW, and we look at 4 lists. So we look at the WHO9, the shortened FDA list of 18 plus their HPHC list, and also the Health Canada list of 44. So whenever you compare the levels of these compounds in the aerosol of GLOW relative to cigarette smoke, you can see that we're seeing about sort of 96–97% reduction in the levels of those compounds. So a really excellent start in terms of trying to assess the risk profile of products like GLOW, as it's the chronic exposure to smoke toxins that's the formation of most smoking-related diseases. One second. Well, next we move into some of our toxicity testing. We do a lot of traditional toxicity testings, a lot of the methods that Tanvir talked about earlier on. One thing I just wanted to highlight here was one of the cutting edge techniques we're using, that's systems biology. And what we do here is we can take 3D airway cells, we grow them in the laboratory, and then we can expose them to smoke, and in a parallel experiment expose them to the aerosol of GLOW. We can look at gene changes within those 3D cell constructs, and we can look at those, measure the perturbations, and we can relate those changes to specific disease-related conditions. Now, what we've done here on these sort of Trivial Pursuits style charts is that we have mapped together 130 disease endpoints into different sort of buckets, so cancers, respiratory diseases, etc. And what you see that the exposure to the cells of cigarette smokes promotes huge responses in terms of some of these disease-related endpoints, whereas with GLOW they're substantially reduced. So again, showing that we saw the reduced levels of toxins in the aerosol, and that's translating through into reduced responses in some of these 21st century toxicological techniques. Okay, so that's all fine, lab-based studies, but what actually happens in humans? So we just conducted a short-term switching study. This is data from our Japanese clinical study, which was published today. Great news. We also conducted another study in the UK. What we do, it's a classical switching design. We bring smokers in, measure their biomarkers on day 1, day 2, then we switch them into 3 groups. First group continues smoking, second group switches to GLOW, third group stops using any tobacco products at all. And what you see that across the number of markers that we have measured, in each and every case, GLOW was reduced relative to continued smoking. And in a number of cases, those reductions were at the same level as smoking cessation or no tobacco use at all. So again, demonstrable that GLOW is both reducing the emissions levels, but also reducing exposure. So now we move into risk. And while no bad comments to the colleagues working in emissions exposure, but this is where it starts to get really, really difficult, because we're now moving into real uncharted territories. So whenever we look at risk, we look at it in 2 levels. So one is the individual risk, so that's looking at risk to the actual user of GLOW. And the second is the population risk, so what's the risk posed to smokers, former smokers, etc., by introducing GLOW into the marketplace. And the studies we typically use for individual risk, we look at things like systems biology, which I talked about a second ago. That's one of our pivotal lab-based risk studies. We also look at long-term studies, then looking at risk markers, so some of the stuff that you may have seen from the PMI presentation earlier on. And then for population risk, then we go into a series of different population studies. But the one I just wanted to focus on today, so just another couple of slides, is around the whole epidemiological modelling. So we don't have the 30 years data that's available on SNUS, but in the absence of that data, we want to use systems dynamic population modelling. So what we'll do there, and what we're doing there, sorry, is that we are going into marketplaces. We're conducting annual surveys with thousands of people within those markets, and we can then place some via smoker status into your population model. So if we recruit, say, 10,000 people, how many are smokers, how many are former smokers, how many are Glow users, dual users, etc. And then we can assign what we call an excess risk to each of those boxes. So smoking would get an excess risk of 1. It's the most risky thing. Non-smoking would get an excess risk of 0. It's the least risky thing. And then the other smoking statuses get other excess risks assigned them. And then by doing the dynamic modelling, then you can assess, okay, well, the impact of bringing Glow onto the marketplace will have this effect on morbidity and mortality. Now, this, having gone through this in the past sort of 3 to 4 years, there's a number of challenges, but also a number of opportunities that exist in this here specific area. We recently published our modelling on vapour usage in the UK. But some of the challenges that we see today are, one, that the dose response curves are unknown for relating exposure to risk. So do you need a 10% reduction in exposure, or do you need a 99% reduction in exposure? We don't have confirmed excess risk estimates for every single smoking status, and there are a number of different smoking statuses. The other challenge I see today, especially with the large number of publications that are coming out, is that there's no set agreement in terms of the criteria that's assigned to smoking statuses. So what defines a smoker, a dual user, etc. And they're probably very, very different. And in the absence of this criteria not being set, I think that can result in very different outcomes from some of these here studies. However, I want to finish on a positive note here. There are several opportunities that, when you take a multidisciplinary approach, it really allows for the integration of both your sort of lab-based toxicological and clinical data to estimate your excess risk. So there is data there that allows you to make some assumptions. Adverse outcome pathways are now becoming more mainstream, so that really allows you to organise and integrate your data into disease-relevant networks. So again, that will be very, very helpful. There's Delphi panel approaches that have been taken in the past to confirm these criteria and the excess risks, etc. But one thing I think would be absolutely fantastic for the industry, and I would talk about that there is everyone all together, is something like these expert ring trials, where all of the modelers from different companies could come together, use the same input data to then align on criteria, the assumptions, and the modelling techniques. So that was extremely quick. Just in summary, so we've now got a framework, like many others, for assessing emissions exposure and risk. The external view on THPs is only beginning to emerge, but I think the data we've got so far has shown the emissions and exposure potential of and risk reduction potential of Glow. We do think that this risk reduction potential is going to take these longer term studies, so that's the studies we've got underway at the minute. And also that these modelling techniques can be really, really helpful for assessing population risk. So thank you very much.